Ready? Alright, for your lower back special test, we're going to start with resisted range of motion. So, we're going to start with you laying down with flexion. So I'm just going to resist you doing a sit-up. So just up, all the way, all as much as you can. And then, we are going to do, so I'm going to have you come up. So come up into flexion. Come up into flexion. And then like resist you hyperextension, so go down. Extension. So down. Then have you flip over. And then you're gonna do a Superman and hyperextend up. We'll have your hands come up to the side here. Then be Superman. Good. And then I'll have you just sit on the edge of the table here. And then for lateral flexion, I'm just going to have you lean to one side and then the other side. So I'm just going to resist you come to this side. And then resist you come this side. And then rotation. So you're just going to come this way. And then resist you this way. And resist you this way.
Good.
Good. And then your Valsalva maneuver, I'm going to have you sit here. And for this, I'm going to have you hold your breath. And then like you're going to breathe in all your air. Hold your breath and then blow it out. I do passive outburst or something like
What's that testing for?
That's testing for like a herniated disc or like any bony.
Bony?
Well, no, just herniated disc and like centralized pain. So like nerve.
Mostly just herniated disc.
Just herniated disc.
Yep.
Okay.
What else? Abdomen.
Oh yeah.
Can I test for it?
What else can you test for?
I asked Kirsty.
Gastrointestinal problems.
Hernia.
You have your slump test. So for this, I'm going to have you sit here. And then you start with rounding your shoulders. So you round your shoulders over and then flex your trunk. Pull your chin to your chest. And then flex your knee. And then extend your knee. And then you want to extend out as much as you can with that. And that's also for like herniated disc and
What's the last part of the test?
dorsiflexion.
Herniated disc, yep. If they have a herniated disc, they won't get very far.
Yeah.
Most people can't get very far.
And then for your spring test, I'm gonna have you on your stomach. And I'm gonna ask like where you would feel like where you have your pain at.
Right.
Right in
Right
here.
in the middle.
Right in the middle. So I would start away from the pain. And
It's
I'm
down
just,
here.
Okay, so down here. And I start away from the pain just to feel like what a normal feels like. So I'm gonna interlock my thumbs here and then find this process and then push down for what it feels like. And you shouldn't get very much movement. If you don't get movement, that's normal for like the facets. And then once you go down more towards your pain, if there's any more laxity or more movement, that could be facet fracture.
What about if it's very, very rigid compared to the others? It doesn't move at all.
That could also be just like the facets laying on each other, or your shrinkage of like the space.
They're locked up. You locked facet.
Your Hoover's test, I'm gonna have you lay on your back. So your back. Your Hoover's test is kind of just like for
What's the word?
like it's
Malingering.
yeah, it started with an M. And so you're just kind of testing to see if your athlete kind of tries, like they come in and say if they have lower back pain and see if they are not really lying to you, just kind of not trying with your back. So with this one, I have both hands kind of raised off the table, and I'm going to ask you to raise your right leg. And when you raise your right leg, they should be putting force down with their left. And if they're not, then they're not really trying to lift their leg. And you just do that with both legs.
Got it.
And your stork standing test, so I'm going to have you stand up. And you stand on the side that's affected. So say it was your right side that hurts. You
What if
stand
it's my back that hurts? It's not a side.
then just stand on your right, just stand on one leg, and then lift your other leg up, and then when you stabilize, you stand all over. and then just have you extend backwards. Hyperextend. And you should have like pain with that.
What is it testing for?
With that, it's sciatica.
Sciatica?
Well, no, your SI joint.
Yeah, can be. What else?
Wouldn't it be like any bony deformity?
Yeah, bony. Yep.
With your open time reflex, I'll just have you sit back for me. This one you go to the tibia, you just run over the tibia, and you're just going down like that. I always
Don't come down here.
Right.
It's just like right along the shaft.
right on the shaft, so just right down here.
What are you looking for?
You're looking for dorsiflexion. No, you're just looking for numbers.
So what's a negative would be nothing. What's a positive test for Oppenheimer? What would happen?
Oh, your toes would spread out.
And what does that indicate?
Indicates that there's a nerve problem.
Nerve root lesion.
So pretty much the same thing for Babinski's is your candy cane. And so like you're down here and you run across the foot like that. And like same thing, you're looking for the toes to spread out.
Should the toes move?
No, that's your positive test.
They should. And this one, they should.
You should.
What happens in babies?
And babies, they crinkle up, they kind of like pop.
They should. It won't be crazy, but they might.
Yeah.
You'll see a little bit of. They should.
And then for your straight leg raise and the SIGS test, so I have you lay back. And for this one, you're testing the hurt leg and you raise it up 30. Well, they should have pain around 30. And so when they have pain here, you lower it to where there's no pain, and then you dorsiflex the foot and the pain should come back. For the straight leg raise and the SIGS test. So now we're on the well straight leg, so you go to the unaffected side, and here you're doing the raise at 30, and when you raise it at 30 they'll feel pain in their other leg, and that's more centralized problems.
What about if I get pain on this side?
The pain on this side and that side,
Just this side.
then that's more like sciatica.
Could be either.
Yeah.
Could be either sciatica. So if this is the leg that's irritating me,
That's
and I get pain with the straight leg raise,
Yeah.
but then you lift this one, and it's supposed to be the well one, and I still get pain. It could be sciatica on this side as well, or it could be centralized that's coming down.
And then for your Koenig's test, this is for your herniated disc. You raise it to 30, and then you have pain here, and then bending the leg will relieve your pain.
What about if it doesn't?
If it doesn't, that's more centralized
Okay.
and not herniated disc. That is your Koenig's, and then your bowstring test is when you get pain at 30, then you flex the foot, and then you come in and put pressure on the popliteal fossa and compressing that sciatic nerve.
What if you recreate symptoms?
Then that would be sciatica.
Most likely, yes.
For your Babinski's test, this is for herniated disc, and this one you raise to 30, and they should have
It's
pain.
not. I know you're saying it, you're not meaning to, but it's to pain.
Right,
Not
to
to
pain,
30,
but
okay.
it should be around 30. And so you raise to pain, and then until you have pain, you lower it to where there's not pain, and then you're gonna have your patient put their chin to their chest, and that should bring. And if that brings your pain back, then that would be your herniated disc.
Centralized?
Yeah.
Most likely, yes.
And then your myotome and dermatomes. So I'm just gonna have you stand up real quick so I can do the dermatomes. And here,
Tell me which one you're doing when we do it.
here at the top you have L1 and L2, and then here you have L3. Well, I would tell you that this would be dual and this would be sharp, and I would do it not with your pants. And so like you would just tell me if you feel sharp or dull, or felt sharp or dull. So then 1 and 2, L3, then L4 comes across the knee, patella, and down, L4. And your L5 runs on this side, and then I'll have you turn around. And if it was the same leg, your S1 would be on the outside, making L, and then your S2 would be on that side.
All the way down though.
All the way down. And your dermatomes, I mean, yeah, that's what I meant. Your myotomes will start with L1, L2, so I'm going to have you keep your hands off the table because something with a sheet. And then here, I have you flex your hip. Good. And then L3, I'll have you extend your knee.